Good afternoon. My name is Professor Michael Kidd, Deputy Chief Medical Officer here at the Department of Health in Canberra. Here's the national COVID-19 update with figures as of noon today. In the past 24 hours, 246 people have been diagnosed as new cases of COVID-19 in Australia. This is slightly up from 228 people yesterday, but we are continuing to see a sustained reduction in daily numbers of cases in Victoria. 24,236 people have now been diagnosed as COVID-19 positive in Australia. Nearly 18,000 people are reported to have recovered from COVID-19. But tragically, we've had another 13 deaths reported in the past 24 hours, all in Victoria. This brings the number of people who have lost their lives to COVID-19 in our country to 463. This is a terrible time for those who have lost loved ones, and my thoughts are with the families and friends of the deceased. Over the past 24 hours, 240 of the new cases were in Victoria. 5 cases have been reported in New South Wales. 2 of these are overseas acquired, and those people are in hotel quarantine, and the other 3 cases are locally acquired. And there's 1 new case reported in Queensland, which is currently under investigation. Clearly, contact tracing of all these cases remains absolutely essential. We must ensure that every new case of COVID-19 is being followed up every day, and I acknowledge the work of our colleagues in Victoria in particular in ensuring and making sure that this happens. Nationwide, there are now 642 people with COVID-19 reported as being in hospital. Among those in hospital, there are now 51 people in intensive care units, which is 1 less than this time yesterday, and 33 people are reported to be on ventilators. Over 5.5 million COVID-19 tests have now been carried out in Australia. A reminder, if you have symptoms, no matter how mild, please get tested and then isolate at home while you wait for your results. We continue to see people with mild symptoms attending work and then later being diagnosed with COVID-19, which of course puts other people at risk of infection. We must all remain vigilant wherever we are in the country. We're continuing to closely follow the COVID-19 vaccine developments in Australia and around the world. Yesterday, the Prime Minister announced the signing of a letter of intent with UK-based drug company AstraZeneca to supply the University of Oxford's COVID-19 vaccine candidate to Australia. Under this signed agreement, should trials prove effective, successful and safe, Australia will manufacture and supply this vaccine. The Prime Minister has also released Australia's COVID-19 vaccine and treatment strategy, developed under the guidance of an advisory group of medical and industry experts chaired by Dr. Brendan Murphy, and they are providing advice to the Australian Government on the purchasing and manufacturing of COVID-19 vaccines and treatments. Clearly, we welcome any developments towards a safe and effective vaccine for COVID-19. In the past week, the World Health Organization has reported that there are 29 vaccines in clinical evaluation, 138 vaccines in preclinical evaluation. The Australian Government continues to monitor all vaccine candidates in clinical trials. We continue to follow our rigorous regulatory procedures in Australia to ensure vaccine candidates are effective and safe for use. Thank you very much. I'm happy to take any questions.
Professor Kidd, the Aged Care Quality and Safety Commission conducted just 63 unannounced visits to aged care homes since March. Is that a sufficient level of regulatory oversight given we are in the midst of a pandemic?
So thank you. So for those who can't hear the question is about the Aged Care Quality and Safety Commission, which has conducted 63, I'm told, assessments and visits of residential aged care facilities across the country between March and now, and a question about whether that's an adequate number of assessments. Clearly, the work of the Safety and Quality Commission on Aged Care is absolutely essential, and I understand there is a rolling process of accreditation visits to ensure that each of the facilities is meeting the requirements under the legislation and ensuring the safety and well-being of the residents of each of those facilities. I can't comment on the actual schedule because I'm not across that or planned future numbers of visits.
To go to the broader point then maybe, how can the Commonwealth and health officials such as yourself be confident that aged care homes are prepared when there is such a low number of unannounced, so they can't prepare for the visits, happening during a pandemic? Would you like to see, or are you considering further measures to make sure aged care is prepared?
Thank you. So the question is, following up, would we like to see further measures to ensure that aged care is prepared during the pandemic? And I think it's really important to understand that under the establishment by the Australian Government and the State of Victoria of the Victorian Aged Care Response Centre, the Aged Care Response Centre has overview of all of the residential aged care facilities in Victoria which have reported outbreaks. There's a case manager for each of those facilities working with the staff of those facilities to ensure the response and to ensure the well-being and the safety of the residents of all of those facilities. So there are a number of ways that we're ensuring that residential aged care is providing safe support for their residents. Can we go to the phones to Josh?
Yeah, thank you, Professor. I wanted to ask about AstraZeneca. It's been reported internationally that the company is asking for indemnification from potential vaccine side effects in the countries it is making agreements in. I wanted to ask if AstraZeneca has asked Australia to agree to, or if we have agreed to, similar conditions around indemnification, or would we agree to conditions like this?
Thanks, Josh. So the question is about whether AstraZeneca has been asking for indemnification of their product and whether that's been part of the agreement with Australia. I'm sorry, Josh, I haven't seen the letter of intent which has been signed, so I'm not able to provide any advice on its content.
On another issue, if I may.
Yep, sure. Yeah.
Sorry. Today, New South Wales Premier Gladys Berejiklian described the fact that only one hotel quarantine security guard had contracted COVID as a, quote, miracle. Obviously, it's good news, but are you concerned that our last line of defence is perhaps miracles, that we just hope for the best that it doesn't spread beyond this one incident?
Mm-hmm. So the question is about the one incident of a hotel quarantine security person contracting COVID-19? In New South Wales. Clearly, hotel quarantine in 7 of the 8 states and territories around Australia has been incredibly effective in preventing COVID-19 from coming into the Australian community. Thousands of Australians have returned to the country and have been in hotel quarantine. There have been a very significant number of people who have been infected with COVID-19 and have been detected while in quarantine, and so we've prevented those people from transmitting COVID-19 to other people around the country. It's absolutely essential that we have very rigorous infection control procedures, support and supervision of the staff who are working in those quarantine hotels. Clearly we have the inquiry underway in Victoria, and there'll be very important learnings and lessons, I'm sure, coming out of that inquiry, which will be heeded and picked up by the states and territories right around the country. Anna?
Thank you, Professor. If you can bear with me, there are 2 questions from me, please.
Great. Can you ask them one at a time?
Yes.
Thank you.
Thank you. There are around 19,000 Australians who want to return from overseas. So what is the AHPPC's advice on whether state caps on international arrivals could be lifted to allow more of them to come home?
Thank you. So the question is around the Australians overseas who are wanting to come home, and whether the AHPPC has provided advice on caps on quarantine. So the AHPPC hasn't been providing advice on the caps. These are determinations which are being made by each of the states and territories based on what I understand they feel is safe numbers of people able to come into the country and be monitored and supported in hotel quarantine. So we do have reduced numbers at the moment. Clearly, with the outbreaks in Victoria, we saw Melbourne stopping receiving people into hotel quarantine, and that obviously had a significant impact and has created a backlog of people overseas. But we are aware that there are many Australians, of course, who do wish to come back to the country to return to their families. Second question, Anna?
Thank you. Qantas has today said it can't see international travel resuming until midway through next year. What do you make of the timeframe, and how important will a vaccine be to that actually happening?
Thank you. So the question is about Qantas announcing they can't see international travel resuming until at least sometime next year, and whether this is linked to the vaccines. Look, clearly we can't predict what's going to happen with COVID-19 over the months or indeed over the years ahead. Anna, we just have to continue to plan and prepare as well as we can. We don't know when international travel is going to be possible for people from Australia. We don't know when a vaccine is going to be available which is safe and effective and able to be distributed very widely across the country. So we just have to wait and see what happens over time, which of course is incredibly difficult for everybody, including for industries like Qantas. Final question?
Yeah, so National Cabinet is meeting tomorrow. I understand that they'll be receiving advice based on what has been learned from Victorian aged care. What other issues is the HPBC prepared advice on?
So the question is what advice is going forward to the National Cabinet meeting tomorrow. I'm sorry I'm not able to preempt what's going to be on the agenda for the National Cabinet tomorrow. That's up to the Prime Minister and the Premiers. Thank you everybody, and thank you to our interpreters. Thank you.